You know, we all know exercise is good for us. That's a given. But what if I told you that exercise is one of the most powerful medicines we have, especially for our hearts? Seriously, like a wonder drug. But what if the way we're prescribing this so-called wonder drug is often, well, just a wild guess? Let's get into it.
So here's the two sides of the coin. On one hand, you have the advice we hear all the time, right? Get about 150 minutes of activity a week. It's simple, it's easy to remember. But on the other hand, what if you could get a tailored prescription? I'm talking about the exact right dose of exercise designed to go after your specific health risks. The gap between these two ideas is huge, and it's what we're going to break down today based on some really eye-opening research.
Okay, first things first, let's just establish how powerful we're talking. When it comes to preventing heart disease, exercise isn't just a nice-to-have, it's a Class 1A intervention. Now, in medical speak, that is the absolute highest level of approval. The evidence is rock solid. It puts exercise right up there with the most effective treatments that modern medicine can even offer. It's a big deal.
And the need for this stuff is, well, it's massive. Take a look at this number. In 2019 alone, there were 113 million people in Europe living with cardiovascular disease. This is not some small, niche problem. It is one of the biggest health challenges we are facing, period.
Now, just to be super clear, when we're talking about exercise as a medicine, we don't just mean, taking the stairs instead of the elevator. The research is focused on something called exercise training. And what that means is physical activity that's structured, it's repetitive, and it has a clear goal to actually improve or maintain your fitness. You got to think of it more like a course of medication, not just random movement here and there.
So if exercise is this proven, powerful medicine, you would think we'd be prescribing it with some serious precision, right? Well, this is where things get a little weird. What happens when the experts don't really agree on the dose?
Let's just play this out. Imagine one patient, just one person, with a very specific set of health issues. Now, you take 53 different, experienced clinicians and you ask each one of them to write an exercise prescription for this one person. How different do you think those prescriptions would actually be? Take a guess.
The answer is just shockingly different. For the very same patient, the prescribed exercise volume varied by 30 times, a 30-fold difference. The lowest prescription was for 300 minutes, the highest, 9,000 minutes. I mean, that's not just a small disagreement, that's chaos. It shows this wonder drug is being handed out with almost zero consistency.
And the researchers, they don't mince words about this. They state it plain as day. A gap exists between the perceptions of clinicians on their exercise prescription skills and their actual prescription skills. So in other words, a lot of professionals think they know how to prescribe exercise the right way, but the data, it tells a completely different story.
Now, I know what you might be thinking. Okay, so it's inconsistent, but isn't any exercise good for you? And look, that's a fantastic point. But this isn't about good versus bad. This is about good versus optimal. And we're about to see why leaving those extra health benefits on the table really, really matters.
And this graph shows the good part perfectly. Along the bottom, you have physical activity going up. And on the side, you have the risk of dying going down. As you can see, the more you move, the lower your risk gets. For everyone. So let's be absolutely clear. Getting off the couch and getting active saves lives. It is a fantastic, crucial first step.
But, and this is a big but, good enough is not the same thing as optimal. That general advice, while it's definitely helpful, is a one-size-fits-all t-shirt. And the research is showing that for people with specific health risks, that one-size-fits-all approach, it's just not powerful enough to get the best possible results.
So what exactly are we missing out on? Well, let's look at the numbers. This is what's at stake. With the standard, generic plan, someone with obesity might lose around 3.7 kilograms. Not bad. But with the plan tailored specifically to them, that number jumps to 8.2 kilograms. That's more than double the weight loss. And it's the same story for blood pressure, for endurance. A tailored plan just delivers way better results. We are leaving massive health improvements on the table by being generic.
Okay, so we've laid out the problem, right? Inconsistent prescriptions are leading to results that are just okay. The great news? The paper points to a much smarter way forward. There's a clear path to building a much, much better prescription.
So here it is. The paper proposes a really logical two-step approach. Step one is exactly what we've been talking about. You build a foundation. Get people moving with general physical activity. That's the good part. But then, for anyone with higher risks, you move to step two. You optimize their results with a tailored exercise plan that goes right after their specific needs. So what does tailored really mean? Well, it means the prescription is built around you. It looks at your specific risk factors, like high blood pressure or cholesterol. It takes into account your current fitness level, any other health conditions you might be dealing with, the medications you're on, and, this is just as important, what your personal goals are. It's not a generic plan, it's a complete health blueprint.
So this personalized approach is the blueprint. But is this all just theory? I mean, can we actually fix this prescription problem? Can we train clinicians to create these blueprints consistently? Well, the research paper gives us a pretty loud and clear yes.
Let's just ask the question straight up. Can we fix this? Can we close that gap between what clinicians think they should be prescribing and what would actually be the best-case scenario for the patient?
And here is the proof. The researchers actually built a digital training platform called the Expert Tool. They had a group of physiotherapists use it for just 1 month. Before the training, their prescription accuracy was, all over the map. But after, as you can see right here, their ability to match the expert recommendations shot up by over 40%. It actually proves that if you give people the right tools and education, we can solve this problem. We can prescribe exercise with the precision it deserves.
And that brings us right back to you. We've seen that exercise is an incredibly powerful medicine, but the dose matters immensely. It really makes you stop and think, doesn't it? Is your current exercise plan just working for you? Or with a little more precision, could it be working a whole lot harder?